Angioplasty is a procedure used to open blocked coronary arteries caused by coronary artery disease. It restores blood flow to the heart muscle without open heart surgery. Angioplasty can be done in an emergency setting such as a heart attack, or it can be done as elective surgery if your healthcare provider strongly suspects you have heart disease. Angioplasty is also called percutaneous coronary intervention. For angioplasty, a long, thin tube is put into a blood vessel and guided to the blocked coronary artery. The catheter has a tiny balloon at its tip. Once the catheter is in place, the balloon is inflated at the narrowed area of the heart artery. This presses the plaque or blood clot against the sides of the artery, making more room for blood flow. The healthcare provider uses fluoroscopy during the surgery. Fluoroscopy is a special type of X-ray that's like an X-ray movie. It helps the doctor find the blockages in the heart arteries as a contrast dye moves through the arteries. This is called coronary angiography. The healthcare provider may decide that you need another type of procedure. This may include removing the plaque at the site of the narrowing of the artery. In atherectomy, the provider may use a catheter with a rotating tip. When the catheter reaches the narrowed spot in the artery, the plaque is broken up or cut away to open the artery. Coronary stents are now used in nearly all angioplasty procedures. A stent is a tiny, expandable metal mesh coil. It is put into the newly opened area of the artery to help keep the artery from narrowing or closing again. Once the stent has been placed, tissue will start to coat the stent like a layer of skin. The stent will be fully lined with tissue within 3 to 12 months. Depending on if the stent has a medicine coating or not. You may be prescribed medicines called antiplatelets to decrease the stickiness of platelets. Platelets are special blood cells that clump together to stop bleeding. The medicine can also prevent blood clots from forming inside the stent. Your healthcare team will give specific instructions on which medicines need to be taken and for how long. Most stents are coated with medicine to prevent scar tissue from forming inside the stent. These stents are called drug-eluting stents. They release medicine within the blood vessel that slows the overgrowth of tissue within the stent. This helps prevent the blood vessel from becoming narrow again. Some stents don't have this medicine coating and are called bare metal stents. They may have higher rates of stenosis, but they don't require long-term use of antiplatelet medicines. This may be the preferred stent in people who are at high risk of bleeding. Because stents can become blocked, it's important to talk with your healthcare team about what you need to do if you have chest pain after a stent placement.